Greetings, this is Tana Lim from Northside Hospital, Gwinnett. I am here to speak about choosing wisely, or as my title suggests, I may actually be talking about not choosing unwisely. Let me explain. Springboarding from an article by Howard Brody in 2010 entitled Medicine's Ethical Responsibility for Healthcare Reform, the Top 5 list, the ABIM Foundation, along with Consumer Reports, started the Choosing Wisely campaign in 2012. Their website states that their mission is to help patients choose care that is supported by evidence and that providers and patients should use the recommendations as guidelines to determine appropriate treatment plans together. While reviewing several of the recommendations many years ago, I noticed something very peculiar. Most of the recommendations were in negative form, meaning that they told physicians to not do certain things, which I found at odds with the Choosing Wisely name. For example, the American College of Physicians states, "Do not obtain imaging studies in patients with nonspecific low back pain." Using slightly different wording, the American Society for Clinical Pathology says, "Avoid TSH screening in annual well visits for asymptomatic adults regardless of age." In fact, it took some time to actually find a recommendation that discussed what physicians should do and not what they should not do. The purpose of the current study was to review all of the Choosing Wisely recommendations to better understand the magnitude of the difference between the number of positive and negative recommendations. The Choosing Wisely website was accessed in September 2019. All of the recommendations were reviewed and categorized into negative or positive recommendations. In all, 610 original recommendations from 91 organizations were tallied. The number of recommendations ranged from 5 to 30 per group. In the table noted, 2 recommendations were given a half positive categorization due to positive and negative statements within the same recommendation. Specifically, the American College of Physicians states, in patients with low pretest probability of venous thromboembolism, obtain a high-sensitive D-dimer measurement as the initial diagnostic test. This would be the positive recommendation, but it is then followed by stating, do not obtain imaging studies as the initial diagnostic test. This would be the negative recommendation. Similarly, the American Society of Nuclear Cardiology says to use methods to reduce radiation exposure in cardiac imaging whenever possible, including not performing such tests when limited benefits are likely. Interesting phrasing indeed, to do something by not doing something. In all, out of the 610 recommendations, only 3 were truly stated in a positive format, such as one by the American Urological Association, which states to offer PSA screening for detecting prostate cancer only after engaging in shared decision-making. As a parent, I think about the things I do not want my kids to do when I tell them to choose wisely. However, as kids mature and we learn to parent better, we start thinking about actually how to make the right choices. In its current form, the many negative recommendations have a tendency to come across as paternalistic, simply telling physicians what not to do. Instead of fostering better communication with patients, it may actually hinder collaboration in the long run. If a physician is told what not to do, there is less room for discussion. A more difficult task is making recommendations utilizing positive language to help physicians choose more wisely for their patients. Thank you. And finally, go Braves.